fourth congressionally mandated national top officials exercise simulated dispersions of radioactive materials in Portland, Oregon, Phoenix, Arizona, and the territory of Guam. This scenario caused great threats to the public's health and to the environment. Hospital emergency room capacity was stressed to the breaking point. Private citizens, private sector organizations, and all levels of government were challenged over a 4-day period. Initial fire, rescue, emergency medical, and law enforcement responders to the scene of an explosion were organized under incident and then unified commands. Patients were distributed among many hospital emergency rooms. Jurisdictional and agency emergency operations and coordination centers were activated to support and coordinate incident commanders leading field operations. A health and environmental unified command was established to arrange operations to supplement hospital emergency rooms, determine downwind contamination, and to inform, screen, and arrange treatment for a large, potentially contaminated population. In a major metropolitan area, it can be difficult to determine who has been exposed to a chemical, biological, or in this case, radioactive threat, and who has not. This should be done in ways that relieve pressure from an overextended medical community. The least costly method of sorting those exposed from those not exposed is to provide enough information for individuals to make their own decisions. The information should assure them and inform them of protective measures and when and where to seek medical services. This is one of several rapid screening point divisions within the operations section of the Health Environmental Unified Command. Each is designed to screen up to 500 people per hour for potential exposure to radiation and for mental health needs. All operations except for decontamination are within this gymnasium. It is an exercise artificiality that radiation instrument surveys of the clients is being done in this gym rather than outside. It is also artificial that doors closed for the security of VIPs and the exit for the shower room decontamination area below the gym cause circular and crossing flow patterns. Here is the flow. First, clients entered through this door and were surveyed for gamma radiation as they walked through a portal monitor. They were then screened by handheld instruments for alpha and beta radiation. If either screening exceeded background levels, they went down a stairwell behind the portal monitor and into a locker shower area for simulated decontamination. Decontaminated clients re-entered the gym from a stairwell to the far left. Uncontaminated and decontaminated personnel received intake forms and filled out personal and exposure information at these tables in the center. Mental health personnel are spotted throughout the process to administer simple mental health surveys and tend to concerns. The intake forms are reviewed and clients are either told that they are okay or they are referred to medical screening 2 near the portal monitors and then to possible treatment. The great majority are reassured that they are okay and walk from medical screening 1 toward the camera and to a checkout table at the upper right. A public health supervisor and leaders organized and trained the approximately 140-person staff in the 2 hours before operation began. Radiation survey instruments and operators came from a number of local, state, and federal agencies. Administrative staff positions were filled by high school students and other community volunteers. Mental health professionals were augmented by university students and social work programs. And high school students acted in scripted roles as concerned residents, each with their own story, wanting to be screened for contamination and exposure.